Hi, everybody. Welcome to Ask Dr. David. As many of you know, I'm an independent thinker, and my thoughts expressed today are for today. It's very possible for how fast things are changing that I will have a different opinion tomorrow or next week or next month. Today, we're going to be talking about COVID-19. And several questions have come in, and so we're going to be going through several of them at the same time instead of just one shorter video. Joining us today is Shari Kulanu, who is both the executive producer of the show, the executive director of my office, as well as my sister. Hi, Shari.
Hi, David. How are you doing? I'm so glad we're doing this show. We've had a lot of questions coming in from families in the community, so let's just dig right in. One of the first questions that people are wondering is, can you please discuss the Delta variant and how it's different? Is it more dangerous or just more transmissible?
So the answer seems to be both. People are catching it much quicker. It seems to be causing more damage. It seems to be hitting younger people faster. We are now seeing younger people in children's hospitals being filled up, ICUs being filled up, where these were really more in older people and people with higher risk situations than what we're seeing now. But it's also been more contagious. People are getting sick within 2 days. People are spreading it much more as well.
Yeah, so you are located in Tampa, Florida. That's your home base. And there's a lot of news going on right now in terms of kids going back to school. So in the Tampa area, Hillsborough County, Pinellas County area, school has now coming to the end of its second week, its first full week. How is it going down there in Florida?
Well, it's going as many people have heard in the news, and it's really predictable. Anybody who didn't see this coming in terms of the very large number of cases that we are seeing, not just in the community at large, but in the school system, probably hasn't been paying attention enough. But yeah, we are seeing many more cases. At the beginning of the school year, by this time last year, in Hillsborough County, there were approximately 19 cases or so of coronavirus that were documented within the schools. As of right now, it's been about 1,500 students, as well as approximately 500 teachers who have tested positive. And with that, and because of contact tracing and quarantining, there's over 10,000 students that are currently in quarantine who are therefore not getting the education that they were hoping to get when the school year started.
Now, a follow-up question to that is, I know there is a statewide order in place from the governor that prohibits mask mandates, but I also know that even before the school year started, some of the districts were sort of bypassing that and putting in mandates anyway. And now more and more counties are kind of coming on board and saying so. And I know that in your area in Hillsborough County, last night, the school board voted to mandate masks within the school. So can you please talk about the Hillsborough County mask mandate?
Yes. So the school year started off as there was a semi-mask mandate, but the parents were allowed to sign an opt-out form. If in other counties, such in Pinellas County, there was actually no, it was really a voluntary type of thing. Now, with the sheer number of cases that have been seen so far, the school board voted yesterday to turn this into a more formal mask mandate while allowing for medical exemptions.
Okay, and so that is interesting because the day that we're recording this is the day after the Hillsborough County put this into place. And as you can imagine, your office, our office, has been getting inundated with phone calls asking for guidance about the mask policy and also asking about a medical exemption that was put into place along with the mask policy. So can you please explain the medical exemption, what it is, and then also explain how our office and you, what your approach to determining if something is a medical exemption?
Absolutely. So first and foremost, since this kind of changed very suddenly and recognizing that many people aren't able to fully get this sorted out as of right now, I am advising people that if they don't feel that they can have their kids safely and effectively wear a mask, but if they don't feel comfortable that their kid's not safely wearing a mask, for the time being, until it's figured out, I would suggest not sending their kid to school so that way the parent feels that they're comfortable that they're not putting their kid in a non-safe situation. Of course, people who are comfortable wearing masks, and last year, the entire year, there was a mask mandate. And so many students who are in school were used to it. Now, because of the fact that there's no more virtual learning from school to school, everybody's back in the classroom, which of course means that there's more people physically there. But there's also going to be kids who were homeschooled or e-learning last year who are in the school system who had not prepared to be wearing masks, even though it was something that people have been talking about. But now suddenly that there's a change. So the medical exemption, we take a very individual approach, as we do with everything in our office, case by case. And so we have questionnaires, and we really, as part of our individual consultations, ask some very important questions, like what types of approaches have families taken in order of in terms of trying to get their kids to wear a mask. But more importantly, what symptoms, what debilitating issues are there that is not allowing a child to wear a mask? Now, I realize that some of our families with children with autism, there's no way on earth that their kids are going to wear a mask. You know, a lot of kids with sensory processing issues. There are some kids who have asthma and other medical conditions where they just can't wear a mask, or they can't wear it for long periods of time. So we are spending time assessing what is the actual need for that child. What is the feasibility? We talk about, for families who are wishing to have their kids wearing masks, but they can't so far, how do we introduce them on an individual basis so that they feel more comfortable doing it? So until we have an opportunity to assess that, that's what goes into our being able to and our decision making for providing a mask mandate. But it's not the type of thing that we can just give out to everybody. There has to be a solid medical reason, as the state says. I have to write a letter that will justify this. And obviously, if I can't justify it, then that could put me in some legal jeopardy as well. So we take this as a case by case basis. And certainly there are some of our patients who can't wear masks, and we want to be able to help those families out, while at the same time we also realize, and because we do believe that wearing masks do provide benefits. It doesn't provide the only benefit. It's not 100%. But we do feel that it does reduce the spread, because let's face it, if a person is wearing a mask, even if there is some air getting through, when there is a barrier, some of it's going to hit that mask. It's not going to all go out. If you remember earlier last year, we talked about viral load. Not as much viral load will get out around a mask as compared to and through a mask, compared to when a person's not wearing a mask at all. So these are kind of the considerations that we need to be taking individually, so we can determine what the best thing would be for the individual family and their child.
Great. Now, I know that you just gave the example of the mask. I want to remind everybody, or for those that are new, towards the beginning of COVID, so about in the middle of 2020 or so, Dr. David did a series of videos on masks, specifically related to masks with kids with school, when kids went back to school in August of 2020. And there's a lot of really great information there on how to introduce masks, how to help your kid be comfortable wearing a mask. So if you check out in the playlist on that, you'll see a lot of other videos that are addressing that. Now, one of the things that you mentioned, David, before we wrap up, is the benefit of wearing a mask and reducing the viral load, which is an important thing that I think that people need to maybe better understand, that when you're wearing a mask, it's not just to protect you, although it obviously does provide you with protection. It's also to prevent you from spreading the virus, which we now know this Delta variant is very transmissible, to other people. So talk a little bit about where you fall in terms of wearing masks and kids wearing masks to school, your personal opinion on this.
Sure. So I recognize that this is a controversial issue, and I always try to weigh the pros versus cons. Okay. From what I can tell, the preponderance of the evidence is that the benefits do outweigh the risks for the typical person, recognizing that on an individual basis it may be the opposite of that. But certainly at the end of the day, the more viral load that's put into a space, that's put into a classroom, especially because people are not wearing N95 masks. That's not a reasonable thing asking them to do, let alone the availability. There's going to be some COVID in the classroom air. And anything that can be served as a barrier to prevent that from happening decreases the likelihood of contagiousness to other people. We recognize that a lot of kids will handle this without a problem. In terms of catching COVID, we also recognize that some kids will not, but we also have teachers in the classroom. So they are older, they're more likely to have other health issues. They may be more at high risk than a student is. And, from a school community, we need to be taking everybody into account when we're trying to talk about safety.
Right. And in addition to the educators, as you said, there's also an entire support staff, janitorial staff, administration. And these are all people that are often overlooked in these situations. So if you are willing, one of the things that I would like for you to talk about is, I know that a lot of people feel that this should be left up to the parents, that this is not a decision to be made by the school. And you are somebody who's been involved with helping local schools draft their COVID policies. You sit on the school board of a local high school. You're involved with your synagogue and the youth program there. So you obviously have a lot of involvement as both a parent and a friend and a physician in your community. So please address your thoughts on this issue and this debate around the personal freedom of being allowed to have your child do what you feel is best, and how that weighs into looking at the community health in general.
Yeah, sure. And this is a really challenging topic, but I also do realize that we live in a society where we do have quote unquote mandates, such as the need to wear seatbelts, to wearing shoes and socks, and wearing shoes and shirt going into a restaurant. So we all do have freedoms up to a certain extent. But I also think it's important to recognizing that part of our freedom also needs to be respectful of other people's freedom and other people's health. And that's where part of this is coming in right now. But I also recognize that, families who do not feel that it's in their child's best interest to wear a mask, that they do have other options, because they do have homeschooling options, they do have e-learning options. I know that there are some schools out there that are not requiring masks the way that the public schools are. So, as part of the freedom of choice is saying, okay, well, if I don't feel comfortable sending my kid to school because I don't want my kid wearing a mask, there are those options there, and that the child can also not be wearing a mask if the family feels that's best, while not potentially exposing other people to a virus that they don't want to get.
Right. So we've covered a lot of topics in a really short amount of time. I know we're going to continue to do these types of series, especially right now when there's so many questions, things are changing so quickly. And so, I want to invite everybody to please stay tuned for our next episode, when we're going to come back and ask Dr. David a lot more questions. So thank you, David. Really appreciate you.
Absolutely. Bye, everybody.
And don't forget, subscribe if you like this channel. There's a lot more content on there to offer you. And if you would like links to some of our other offerings, please check the description below. Thanks so much.